Hello, friends. Today on Mindful Mutiny, I interviewed the leadership of a retreat called Transcendelic. This is a ketamine-based psychedelic retreat. And these are medical trained professionals and a Buddhist monk that are working with legal psychedelic medicine to help people with everything from addiction to trauma to just personal wellness. And in these wonderful retreat houses that they have and these centers that they work with, it's a very thoughtful discussion about the state of psychedelics right now in our world, in the state of California, what's likely to come, how they work with people, and what it does for people. It's a really, really great interview you're not going to want to miss. So enjoy Mindful Mutiny today. Welcome to the Mindful Mutiny Podcast. I'm Jeremy Van Wert, CEO and transformational coach. I help professionals like you dedicate as much time to yourselves as you do to your work by forming a strategic plan for your life, your future, and your goals. Make sure that you subscribe to Mindful Mutiny. Mindful Mutiny is a podcast about people who thoughtfully rebel against the status quo by bravely pursuing their highest potential. Your reviews, your 5 stars, your thumbs up, your comments really help with everything that I am doing to grow this podcast. And today, I'm so excited. I woke up early for this. I'm so thrilled to have this wonderful team. Today, we have a really thought-provoking interview with the leadership staff of Transcendelic Retreats. Introducing the leaders of Transcendelic, a pioneering psychedelic retreat center dedicated to transcendence through transformative experiences. Their holistic wellness retreats offer a safe haven for mental and physical healing combined with legal psychedelic medicines and therapy, yoga, and nature immersion. Led by a team of licensed healthcare professionals and passionate experts, Transcendelic fosters an environment where inner healing, intelligence, and all of these sorts of things flourish. With their unique approach, they expedite healing, turning years of therapy into a few days through profound transformation. I'd like to welcome the CEO and co-founder, Dr. Amy Milroy. Dr. Milroy, thank you for being here.
Thank you so much for having me.
Dr. Amy Milroy is a board-certified psychiatric and family nurse practitioner. Inspired by her own profound experiences with psychedelic medicine, Amy has embarked on a mission of helping others achieve lasting transformation and fulfillment, culminating in the launch of Transcendelic. We also have here Dr. Salil Kalra. Dr. Kalra, thank you so much for being here.
Of course, thanks for having us.
Sal is a board-certified physician in internal medicine, pulmonary, and critical care. Inspired by his experiences in the ICU, Sal advocates for a holistic approach to healing, envisioning psychedelic-assisted therapy as a transformative tool for patients, families, and healthcare workers alike. Sal is the other co-founder of Transcendelic Retreats. And finally, we have Jacques-Pierre Cole, who is JPC. He is a Zen master and Bon Buddhist monk. JPC is an ordained Zen master and Bon Buddhist monk whose journey from trauma and struggle to spiritual enlightenment has led him to a life of service and mindfulness. Through his experiences, he has found solace and purpose in teaching and guiding others on their own paths of healing and self-discovery, sharing his wisdom and insights with diverse communities around the world. Welcome to the discussion today, JPC.
Thank you. Thank you. So happy to be here.
You know, the thing that I hated the most when I was in grammar school was reading out loud, and I've gotten a little bit better at it, but it's never been easy for me. So
that was fantastic.
Thank you so much. I know that everybody's going to have it on ×2 anyway, and so I'll sound faster. So Amy, I'd really like to start with you in this. Can you talk a little bit more beyond the bio that I just read about Transcendelic and the work that you do, what you're up to, and we'll just kind of start there.
Absolutely. Yeah. So, Transcendelic is something that was born of really my own personal journey in healing and also my journey as first a nurse and then a nurse practitioner, just witnessing the ways in which the healthcare system doesn't allow people to get to the root of their suffering and transcend their struggles. A lot of the ways in which we manage, people's symptoms, it's really just symptom suppression and just kind of allowing people at best to function and get through their day, but not actually allowing them to see what are the real roots of my suffering? What are the patterns that are bringing me to this point in my life? And a lot of times those patterns are things that haven't been acknowledged adequately in healthcare. And that's really, honestly, a tragedy. It's kind of, the medical model says, like, take this pill and correct your neurochemical imbalance, and boom, you're going to be fine. And then often that's not the case for people. And sometimes even, by suppressing those symptoms, people are not getting the information that they need in order to help them heal, in order to recognize what the real roots of suffering are. And so when I discovered psychedelic medicine and psychedelic assisted therapy, it was a total game changer for me in my personal and professional life. And it's all I want to do. And so, yeah, that's where I decided to co-found Transcendelic along with Sal, is just to have a haven for trauma-informed healing where people could actually explore what are the roots of their suffering, what are their strengths, and how do they allow these things to come together to flourish.
So, how long ago or how long into your medical journey of you being a licensed nurse practitioner did you have a psychedelic experience that changed your view of what holistic care actually is?
Yeah, so I had my first psychedelic journey about 5 years ago or so. At the time, I didn't really know it was a psychedelic journey. I was receiving Spravato treatment, which is S-ketamine, prescribed ketamine for treatment-resistant depression and PTSD. And, at the time, I realized that it was a total game changer. It was unlike anything else I'd ever gotten. I had gotten to the point where, different healthcare professionals were just saying, well, shrug, we don't know what to do with you. You're not getting better. I guess you're maybe the problem. Like, maybe you can't be healed. So good luck, I guess, and maybe see you in a few months to renew this prescription. And so, when I heard about ketamine treatment, I thought, well, that's a little off the beaten path, but hey, like, let's give this a try. And yeah, it wasn't even treated as a psychedelic at the time. It was treated, as the medical model, like, here's the molecule, get the molecule, go home. So it was only a little bit after that that I realized, oh, ketamine is actually a psychedelic. And of course, that opened my eyes to the possibilities of other psychedelics as well. And so, yeah, really only in the last 5 years that my eyes have been really opened, and I've worked with a few different psychedelics personally, and I've had the great privilege to work with many patients with ketamine and patients who have worked with other psychedelics on their own time as well.
So if I might ask, your own depression, you're working the life of a nurse practitioner, which is an extremely demanding position. You're attempting to care for others, and the bit that I know, having worked in a large hospital system, is that the demand is absolutely outrageous. And there's also some moral wounding that goes along with not feeling like you're actually helping people on their road to healing. I would imagine that some of these things are things that factored into you feeling the way that you did before you took ketamine.
Absolutely. Yeah. As with so many of us in healthcare, I really, I got into healthcare to hopefully all of us in different ways to help people heal, and not only to help people heal, but to, again, get to the deepest roots of healing. And what I just kept seeing time and again was the same folks coming into the hospital again and again with similar issues, the same folks coming into my clinic again and again with similar issues. and sort of a gaslighting on the part of the healthcare system of like, yeah, again, you're the problem. Well, we don't know why this isn't working for you. It's supposed to work. I guess let's switch it up to another extremely similar molecule that should be working better because it's brand new and it's more expensive, but actually it's still based on, the serotonin hypothesis. If we just increase the serotonin levels in your brain, then you'll feel better. And that's not the reality for so many people. It's very ahistorical. It's very trauma uninformed or trauma rejecting. It does not acknowledge or honor the lived reality that people are coming from. And, I was seeing people from my first moment as a baby nurse, I was seeing people coming from violence in their families, in their neighborhoods, lack of education, lack of socioeconomic resources. And it's like, okay, take this little pill, this is enough. It's not. There are great systemic issues that I think have been largely ignored. And, in order to really help people flourish, we have to acknowledge those and just the context people are personally coming from. And so it's just been, I've been, seeking my whole career in healthcare, seeking these deeper, these long-term solutions for people that go beyond the Band-Aid or just symptom suppression approach.
So you're part of this big this big hospital system. You are having to participate in the gaslighting of patients, the treatment of symptoms, the watching people walk out and knowing they're still sick and knowing inside you that you are not doing what that person really needs to feel good in their body. And you take ketamine for the first time for yourself. What was the kind of awakening for you? What inside yourself changed? How was it different for you than whatever SSRI you may have been on before?
Such a fantastic question. Yeah. So, I honestly learned to love myself working with ketamine. Because of the trauma I had in childhood as well as in adulthood, I had been told a lot of lies that I had come to believe about lack of worthiness. And I did not have a deep-seated self-respect, self-compassion, or the ability to, or desire even maybe to protect myself from things that were jeopardizing my wellness. And so out of this self-love that was more than just a concept or a sort of logical reality, it was a lived, embodied thing that went down to the very core of my being. Everything changed. And therein lies the real effectiveness of psychedelics. It's not the molecule, it's the journey to a degree. Certainly the insights that come from the journey, but it's the way that you change your life because of all of that. And so I changed my life in so many ways. I went back to school to become a psychiatric nurse practitioner. I worked with patients in different contexts. I realized that those contexts, the companies I was working for, they still just weren't quite what I was looking for. And so I came to the realization, if you're really going to take care of people the way you yearn to, you're going to have to create it yourself. And so that's how that kind of came to fruition in my life.
So your identity had been built on some negative self-talk that had been built through your lifetime, and the suppression of those feelings from the prescribed medications was something that helped you maybe not think about those or maybe not feel that as much. But what the ketamine did was actually separate those negative thoughts and concepts and ideas from your personal potential. And it feels like it kind of woke you up.
Yeah, that's really fair to say. It was an awakening. And also for me, as someone who is a highly sensitive person, who is very prone to carrying around the burdens of others, carrying around the burdens of the world, feeling the pain of just all the people and all the things, ketamine helped me to realize how much of that was actually mine. And it was a much smaller percentage than what I'd ever realized before. And so there was so much freedom in that, and just a dawning and an awakening for sure that happened in working with that.
So brilliant. Yeah, I'm very familiar with the whole highly sensitive person thing. My wife is highly sensitive, and her journey with psychedelics has been something that has been extraordinarily healing to her heart, and her conception of her own power. It's so profound. So thank you for kind of talking about your personal story here. Dr. Sal, want to ask you some questions about your work because you have had a similar experience here. So, you are the chief medical officer at Transcendelic, and can you talk a little bit about what you do there?
Sure. So I like to think of myself as somebody that is keeping everybody safe. So, before people arrive at the retreat, we do an extensive physical and psychological health history and, do a proper assessment in terms of assessing if they have any sort of history of any cardiovascular issues or high blood pressure or things that, you know, may potentially cause harm if we were to give ketamine. So we do a very extensive screening to make sure that, everybody will not have any significant side effects related to the treatment. And so that's, part one of of my role. And then part two is, during the retreats, I'm involved in both administering the medication as well as close monitoring of any sort of, side effects related to the treatment, monitoring blood pressure and heart rate and oxygen levels, and treating any sort of side effects that do come about, like nausea or headaches. And then I think that's the major part of what I do. And then I like to think of myself as also somebody that is just a peer supporter as well. So, I'm not, licensed as a therapist or in the mental health world, but I do think of myself as somebody that's very friendly and approachable and supportive and down to earth and always willing to listen to people's stories and offer my perspectives. And so, I think I kind of extend beyond the medical, piece of it, and also just a friend that people can have at the retreats as well.
How did you become interested in psychedelic medicine?
So I think, I also think of myself as a highly sensitive individual. I come from a background of having, relatively hypercritical parents, and they were very focused on, my personal growth, and that put a lot of pressure on me growing up. And I think, as I went to college and started meeting new people and having new experiences, I just wanted to maybe kind of open my eyes to what else is out there in the world. And, so my first psychedelic experiences, they were in college. And at that time, I don't think I really used them intentionally for any sort of healing work. It was more just kind of, self-exploration, just seeing, who am I and what is my role on Earth. And, then as I started to age and I went through my medical training and everything and became a physician, and similarly became very disillusioned with the way we were practicing healthcare, especially in the critical care setting where individuals that are at the end, they're extremely sick and may have never discussed with their loved ones about what they would want for themselves in those situations when they are at their end of their life. And me as a healthcare worker and physician, I often have to act in ways that may, in my opinion, are sometimes harmful for the patient, which is kind of goes against our code of ethics a little bit. And so that kind of goes back to the whole moral injury thing that you were discussing a little earlier. We have to do a lot of sort of invasive tests and surgeries and procedures, and a lot of times I can sometimes see the writing on the wall for the patient that that their body's giving up, but yet the family wants me to keep going and going and going. And so that was very difficult for me. And so, that only got amplified in the age of COVID. I was in my pulmonary and critical care fellowship at the time, and seeing, countless patients, suffering alone in their hospital rooms. And was pretty tragic, and families weren't allowed to visit, and we had to gown up in like almost like hazmat suits in order to come see the patients, and they were just very scared, and so that was very troubling to me. And around the same time, I was also dealing with the death of my father as well. He developed lung cancer while I was in my pulmonary and critical care training, and so it was around that time that I felt like something had to give, and I started to explore the role of psychedelics in healing my own mental health and mental health issues, I would say. And through that, I did discover that I am not only a good physician in terms of I can bring a lot of the wealth of knowledge required to treat people properly in that setting, but I also am a good person, and I have worth, and I can be the person that allows families to make really difficult decisions at the end of life. And I think I just discovered a lot about myself and my own self-worth through psychedelics around that time.
You also talk on the website about noticing issues that are going on with healthcare providers, and that's something that I've kind of like brought up a few times just in this conversation. Can you talk a little bit about healthcare providers, the unique stressors that there are on them? I know that there's a certain amount of, I really want to help people get better and heal them when someone begins their becoming a medical provider journey, and then they get 10 years into it and go, this doesn't feel like what I hoped it was going to be.
Mm-hmm. Yeah, there's definitely a lot to that. I'll talk about a number of them. Like, one, I would say, is the rigors of the time constraints, I would say, is one major thing where we're expected to see 20 to 30 patients a day, and we as healthcare workers want to give our all to each patient, but when you feel like you're against the clock constantly, you have to see them as quickly as possible so that you can move on to the next patient and make sure that you're documenting in their chart and filling out these extensive notes so that you can, so that the insurance companies or the hospital administration can, get their money and everything. It's a lot, and you do get a lot of pressure from the administration to keep seeing people, and it almost feels like you're just a cog in the wheel, that you're replaceable, and that your role is really just to make sure that you're seeing the patients so that you can document and bill, and so that they can collect their check, and that's really troubling. Another is, especially the nurses, sometimes they have 8 to 10 patients per one nurse, and they have constant demands of, being able to administer the medications at certain times, or wheel the patients to their CT scans or whatever, and they're constantly being pulled in a million different directions, and families are extremely demanding of what's they want everything done for their loved one, and so there's a constant battle that the nurses especially have to face on being pulled in a lot of directions, and so those are two major challenges that I think. And then there's a lot of just self-sacrifice, I would say. A lot of times healthcare workers, we don't even have the chance to use the bathroom, have a nice meal for lunch or something with our colleagues. It's just you just find a little, maybe 5 minutes here or there that you can just use the bathroom, get something to eat, and then move on to your next task. And so it just feels like you're just constantly against the clock, and you have to give a lot of yourself in that way.
There was another thread in what you were talking about a little bit earlier, and you mentioned your father's passing, and you also mentioned the end of life experience that you were witnessing of patients that you had in the hospital, the role of fear, the role of grief in this, um the sense of personal responsibility that there is for the surviving people, and that includes the health providers that are caring for people in the end of life and watching their experience. Can you talk a little bit about how your concept of life and death has changed in the context of this work that you are doing now, the perspective that people have, the perspective that you have, and the experience of death?
Mhm. Yeah, it's especially in the ICU setting, seeing people of virtually, I've seen people as young as 18 and as old as 100 um, get it, become very sick and become critically ill and pass away. And it really puts things in a new perspective, like you really, I mean, we talk about it, obviously, everybody kind of thinks about their own mortality. And, you kind of always are wondering, like, when's my time going to be? And it really, it's driven home quite a bit in the hospital, where you could see, anything can happen at any time, right? And so it has really, really made me value just living the best that we can, in every moment that we have, being blessed for, having these moments. And so I think it has taught me to be more present and to, to just really just value just being, rather than just constantly doing and trying to achieve. And so I've become less achievement focused and more just, I want to just live my life and be happy. So
Brilliant. That I think is, if there's really one of the top 5 things that this medicine can do for us, it can help us gain a perspective on things like fear of death, fear of ourselves, fear of our own phobias, and put things in perspective, and so that we're not as caught up in fear-based decisions, and we can make decisions that are truly uplifting and positive and life-giving for us and the people around us. And so thank you so much for all of that. And I want to get to JPC. JPC, can you talk a little bit about the role that you play at Transcendelic, and what you do and how it works?
Yes, absolutely. I would say the role that I play is helping to create a safe space, right? For people to really just blossom out of that. When people go anywhere, and sometimes it takes a while, it takes a few moments to really decompress. So through mindfulness, through meditation, through qigong practices, through several other activities that we do, I help create that safe space for people to release, renew, and really just focus in on themselves. That I would say is probably the top thing that I do, and really just as Sal was saying, I provide a lot of peer support as well. I think it's, I pride myself on being an extreme listener, and sometimes people just need to sit and have someone listen and feel like they've been seen and heard, and that's one of the many things that I provide with Transcendelic Retreats.
So on these retreats during the treatment, you are there. You lead some amount of meditation.
Mm-hmm.
You do peer support and making sure that people are feeling safe, supported. Sometimes people want some hand holding. Sometimes people just want a human being there. Is that kind of, am I getting that right?
Yeah, providing that stable support, and not just meditation in the form of sitting and just being quiet, but meditation in the form of just, as I mentioned, in Qigong. So there is meditation that involves movement. There's meditation that involves chanting. There's meditation that involves walking. All sorts of styles of different meditations that bring that to, help with their journey, help with their pathway, help to their pathway of discovering or wherever that healing is going to lead them.
What is your own background in all of this?
Sure. So, my background is I am a person who has bipolar depression, ADHD. I am also a survivor of multiple suicide attempts. And so growing up, when I was in the heart of being diagnosed and attempting suicide and really battling my depression, I never really had a spot where there was a perceived safe space. And what I mean by that, I did not have a space where I could truly allow myself to be and understand where my suffering's coming from in that pathway of healing. And I think sometimes that's what happens. And so I was very good at creating a lot of distractions to avoid that safe space or to avoid myself. And in that, unfortunately, there came to many times that I was going to end my life and attempted multiple times to do that due to the distractions never being enough and eventually coming back to the suffering that I was in. That led me to really lower my pride, my ego, lower the thought that I know myself, and try to discover not only where my suffering came from, but what pathway to end that, and adopting multiple different ways of facilitating how I was going to heal and being open to that, right? Trying things that I thought were very foreign or uncomfortable for me, but going into that space because it was uncomfortable, knowing that, hey, this may facilitate me healing and facilitate me being in a safe space to allow me to heal. So that is really my background, along with a lot of jobs that were service. I was in the military. I was a cop. So there are many things that, as people see me now, would never think that I did prior to this, but all that facilitated my healing. And now, in a space that I'm in, I want to help others to discover whatever that path may be, whatever vehicle they need to also heal and free themselves of this continual suffering that I was in.
The path from police officer to Buddhist monk. That's a heck of a bridge there.
It is. It is. When I was a police officer, I feel this happens for many people, that you have a value system, and sometimes you're in positions or jobs that don't align with that. And when they don't align, it creates this just uncomfortable, doesn't quite feel right. You kind of question what you're doing. And that's how it was for me as a police officer. I did the job well, but it never really aligned with how my philosophical approach to life. So when I left that job, there was a lot of emotional wounds, physical wounds, unseen. I'm not saying just the wounds that you see, but I'm talking about the mental wounds and all the things that I had witnessed was just deep in. And so I started searching for a way to understand that, remove that, because I was a person who tended to isolate at the time, which didn't help being bipolar or things like that. So I was very fortunate that I met a gentleman who would then become my mentor, who was a Tibetan Buddhist monk, and pretty much followed his teachings. And when I say follow his teaching, the main thing that he did was just pin all these questions for me to discover, and then also create that safe space so I feel all right to express who I am, what I'm feeling, what I'm thinking. And through that's slowly I got to a point where he asked me to teach. He asked me to become a ordained monk. I refused a couple times, and then finally I thought, you know what, this is aligned with what I want to try to provide to people, is a supportive person who's been through quite a bit of trauma and who has come to a place where I'm very comfortable where I'm at and managing my mental illness to aid others. And that's where I'm at.
You're not at all alone here in the next couple of episodes, I'm going to have a person who is a police officer who didn't want their face to be shown, who was a police officer for 15 years, and she's going to be coming on and talking about her experience of trauma after trauma after trauma after trauma in doing the work out there, and how it led her to really becoming a healer of others. But these professions that we're talking about, it feels like I want to be a police officer because I want to help people. I want to become a doctor because I want to help people heal. I want to become a nurse because they're really on the front lines and they can really help people feel. You get into it, and it's so industrialized. It's so you're so busy, and you're so forced into situations where you have to move fast, and you don't truly get to care for the individual. And that are the little those are the little cracks in your heart as you're doing those kinds of jobs. And I imagine that this road that you're on, really sitting with people who are healing, is something that's so profoundly meaningful for you.
Incredible. And it's incredible to witness and observe and see the work, right? To see this create this new foundation where people feel lighter, they feel better, they feel able to face some of the things that they may have not been able to face before. I mean, it's each time that I work with Amy and Sal and we work with individuals, it's probably the most beautiful thing that I can witness, to see that transformation of a new beginning, like a sprouting flower, right? It's like, cool, you sprouted, and now we can cultivate that to grow and blossom, and it's a beautiful thing.
Thank you so much for that. I'm so glad to be able to get to know each one of you a little bit better. And Amy, I think the next subject here, I'm going to kind of toss it your way, but this is kind of for anybody. I wanted to talk about ketamine, psychedelics, and media hysteria over these things. We recently had the very unfortunate death of Matthew Perry, and ketamine was involved in that. This is a man who had a lifelong relationship with substances and depression and anxiety, and really nothing ever being enough. I just recently finished reading his book. It's really a sad tale of his long suffering. And also, it was only a couple of months ago that there was a pilot who was on an airplane, and he was not flying the plane, but he was on a commercial aircraft, and he had maybe taken mushrooms a couple of days before, but it sounds like he was also on some sort of big binger or something like that. I don't know. And that he reached for a couple of the switches that he shouldn't have reached for. And the media immediately went into, pilot high on magic mushrooms tried to kill 300 people. And so there's a lot of this like jumping to conclusions of what these things are. Can we start with the whole Matthew Perry incident in the context of ketamine? How safe is it? And what are the warning signs that people should be kind of thinking of with regard to this?
Yeah, so the Matthew Perry tragedy of him dying, it really truly is tragic. This is someone who had struggled with substance use disorder with different substances over time, really had a lot of demons. And, when we look at the 4 F's of trauma: fight, flight, freeze, and fawn, this is someone who was in flight a lot, trying to escape, trying to dodge that pain that was feeding the addiction. As Gabor Mate says, don't ask why the addiction, ask why the pain. And so this was someone who was in a lot of pain. And yeah, so, ultimately my understanding, from what was uncovered with his death is that he was on a very large amount of ketamine. Reading between the lines, it appears that he likely did not receive it via prescription. It was being used recreationally through some other source. A very high amount, more than should be given. He also, I understand, was in a hot tub while he was intoxicated, under the influence of ketamine. And additionally, he had some chronic heart condition that I don't know that it was being treated, or at least if it was, maybe not adequately. and something that would have been a contraindication actually for working with ketamine. And so therein lies, really the risk. The main risk with ketamine is for folks who have severe chronic heart disease. It does put some strain on the cardiovascular system. It's an interesting mix because it's relaxing in the central nervous system. It's a central nervous system depressant, but it's also stimulating in the cardiovascular system. So we do see heart rate go up and blood pressure go up. So if someone already has a compromised cardiovascular system, as it sounds like Matthew Perry unfortunately did, that added strain of this medicine or anything else that can cause heart rate and blood pressure to go up, whether it be Adderall, Vyvanse, ketamine, whatever the substance is, that can be enough strain to push someone over the edge. Particularly in his case, it sounds like there was actually drowning involved as well due to the hot tub. And so this was really multifactorial in the case of Matthew Perry's death. And it really is unfortunate that this tragedy of a man with these demons and this pain was made by some news outlets into a demonization of ketamine, right? Ketamine is actually a very safe substance overall. If you get screened for it properly and you are someone who does not have chronic heart disease, that's the main thing. That actually people are safe to work with it. And so, we screen people when they're going to be working with ketamine from a psychological and a physical standpoint to make sure that there isn't anything that would rule them out for working with it. But as long as people are properly screened, it is a very, very safe substance, particularly when prescribed, because then you know how much you're getting, you're getting a clean supply, it's not mixed with anything else. And so, yeah, overall, a very safe substance.
And so, Sal, with regard to a substance like ketamine or even any other psychedelics that you might be willing to talk about here, what the average person might ask is this addictive? Nancy Reagan told me I shouldn't do this sort of thing. And so is it addictive? What is happening in the brain with ketamine?
So I'd say, theoretically, any substance that we ingest or anything for that matter, it has the potential to be addictive. But psychedelics, including ketamine, have an extremely low risk of any sort of addictive potential. What's actually going on in the brain is there is a release of, it causes a release of a neurotransmitter called glutamate. And when glutamate gets released, then there's another substance that kind of increases in the brain called brain-derived neurotropic factor. And what neurotropic means, it means brain or neuron growth or nutrition of some sort. And so essentially you're enabling some rewiring of neural pathways. And so I know Amy had mentioned, the patterns that people have that kind of got them to certain points. Over time, those patterns that we fall into become really easy to go down. And so what ketamine allows for is rewiring of the brain so that you can, in conjunction with good therapy, you can essentially create new neural networks in your brain and go down different pathways that are more adaptive. And so it has that potential.
So when you're talking about with the proper therapy, you're talking about what's called integration. You've got the several therapy visits that happen before you have the actual high dose event that occurs, and then there's therapy afterwards that helps with really solidifying those new neural pathways, those new means of thought. What did this sensation mean, and what does it mean for my future and everything? And am I kind of understanding that correct from you?
Mm-hmm. Yep, exactly.
Yeah. And so when you are prescribing this, you obviously you go through a long checklist of things, and you kind of talked about this a little bit earlier, to make sure that people are right for this kind of medication, and you are there and you monitor their response to this and make sure that if somebody has a negative response to something, that they are able to get whatever care that they require?
Sorry, can you say that again?
Yeah. So when you're there with people who are doing the ketamine treatment, you're overseeing them, not just simply from being there for them. You're overseeing them from how their bodies are reacting to this, and so that they are remaining safe. And if they would require a higher level of care, something could be done for them.
Yeah, exactly. Fortunately, the dosages that we're using are extremely safe and have an extremely low risk of any sort of serious adverse reactions to happen. Um, you know, Even in a pediatric setting, like a pediatric ER, for instance, kids would receive some of the dosages that we're giving to these patients. If let's say a kid fractured their bone or something like that, ketamine is sometimes used as a pain reliever in that setting for children. And so that kind of puts things in perspective. We're using it at a dose that's sub-anesthetic, so it's not something that's causing people to go into uh, that we'd be using for surgeries or in the intensive care units, extremely lower than that amount. That being said, we are carefully monitoring their vital signs before and after each treatment. And so if we did notice that somebody's, let's say, their blood pressure or heart rate were extremely high and we're not able to get it down properly, we would be essentially we would call an ambulance, or we would have we would get people the appropriate medical care that they would need. But and we also do have equipment for in case there's any sort of serious cardiac event that were to happen on site. And so we are prepared in case anything like that were to occur. But fortunately, we carefully screen everybody, and we're not really worried about something like that happening.
Wonderful, wonderful. And this next one is for you, JPC. I imagine that a lot of what you do is in the teaching of skills, the teaching of mindset going into this, and the reminding of mindset, skills, things that people need to keep in mind when maybe they're experiencing something that is either wonderful or distressing or something like that. So can you talk about some of the skills that you teach and how you help sustain people through in a very holistic way?
Yeah, absolutely. So, the first thing is, the wonderful thing about this is they're meeting people where they're at, right? And having what I help people with is discovering what that path is uniquely to them. There's several different things that I can apply or give a foundation for. Many times that is that's a morning routine for people, a evening routine for people, something to grow and be grounded with, because I find that that's what the people I work with and people that are coming here, that's usually where you have the experience, you have the journey, you have these new pathways, and you're going back home. And it's like, how do I continue along with the integration circles? How do I continue on that path? And sometimes the smallest thing when it comes to meditation or having just a smallest routine, something that you can do daily, is what I teach, and how to integrate that in your life. Meditation, I'll go with that. It can be daunting for some people because they think, I can't sit there for 15 minutes or 20 minutes, and that's too long, and I can't do that. And that's not how I want people to feel, or I want people to look at that as this is some huge mountain they have to overcome. But we talk about, when you're in the shower and you lean your head forward and you breathe, right? There's a meditation right there. Or when you're making your coffee, one of my favorites, when you make your coffee, you're a little bit more mindful, right? And these types of little micro observations and mindful moments in your life and in your day can lead to these grounded, more routines that build on top of what the new pathways that you have. And so that's really how I teach, is how do you integrate these micro mindfulness moments into your life and build on that.
Yeah, mindfulness being one of the base level skills of basic spirituality. So this next question is about spirituality versus religion. When I have guests on, I'm really interested in their own spiritual journey. And I find it a little bit interesting that some people can speak in very advanced terms about spirit, about their own spirit experience on earth, and some people look a little confused and dumbfounded because they equate spirituality with religion, with a very organized thing where you go and you sit somewhere and you learn something and you join home groups and things like that. So when you're what you bring to the table are the basic skills of just basic spirituality. People don't seem to quite grasp it. When we're talking about meditation, we're talking about a form of prayer. And we're talking about prayer, we're talking about a form of meditation. And so what do you kind of see in people in this, I don't know, spiritual impoverishment that seems to be so widespread in a society like ours? What are you seeing as the wounds that people are walking in with because they don't have a spiritual base or vocabulary?
Sure. Well, I would say the first observation I see is exhaustion, right? Just overall, if I were to put a word to it, life exhaustion, because there's so many things happening, there's so many things distracting us, there's so much movement that I feel that people are just lost, exhausted, and trying to figure out where do they go, what direction to go, who they are, who they want to be, when many of those answers are here, right? But there's whatever obstacle blocking them from seeing that. Something I wanted to add to what you're expressing is that for people to understand that Buddhism is just a philosophy, so it's not a religion. You'll hear some people say that it is, but it really is just a philosophy to life, right? And it's all about your self-discovery, whatever that pathway may be, or whatever you decide it helps my self-discovery. That's what Buddhism is really all about. It's just the philosophy of how to live your life. And so when people come to the retreat, that exhaustion and having that safe space that they can start from becomes that beginning, right? And becomes that not, well, I think I'll stick with the same word, that beginning of their healing direction. Not healed, but the beginning of that healing. And then, of course, the work comes from there. So what I'm helping people understand, that all that wisdom, all that power, all that beauty, all that spirituality starts here and works its way out, as opposed to I need to find it out here first and bring it inward, right? We want to work inside out.
So one of the things that the Western medical model has incidentally done is it's separated the role of spirit from healing and from getting better, as if the heart is the same as a broken collarbone. And so I wanted to open up this discussion about spirituality in whatever way, Amy and Sal, you have ideas and what you've noticed, because this has obviously moved you to get into this form of healing of the spirit, a more holistic approach to working with individuals. And so the role of spirituality and healing, the role of these things, I just wanted to kind of kick this over to you and see your thoughts.
Yeah, we really do have in the Western medical model a tremendous way of divorcing mind from body and divorcing both of those from spirit, and saying, like, is this a mental illness or a physical illness? And it's like, well, maybe this person is exhausted because they have diabetes, and maybe they also have depression, and maybe a large part of the reason why they have diabetes is their depression. And the more that you really sit and listen to people's stories, the more you realize these lines are really artificial, you know. We are holistic beings. We are spiritual beings. We are mind, body, spirit creatures. And so that's such a big part of what I love about working with psychedelics is that people have the ability, whether with ketamine or whichever psychedelic of choice, they have the ability actually to commune with spirit, to commune with the divine. People meet God. They meet sometimes loved ones who have passed away. They meet their ancestors. They reconceptualize their place in the universe. They see the unity and oneness of all things. Don't just see it, but feel it to their core. And this changes so much, right? This feeling of we're not alone. There is something greater, whatever that may be, whatever our particular lens is, because I think that, you know, all the world's religions have something in common and have merit and value, you know. And so spirituality becomes a really big part of a lot of psychedelic journeys. And so it really speaks to how this is a universal phenomenon that we can touch into. And actually, there's even a lot of overlap between what people experience in a near-death experience and in some psychedelic journeys, particularly as they get to the higher, more mystical doses. There can be so much overlap. They can have that experience of ego dissolution, you know, and then oneness with everything. And then, yeah, truly meeting the divine and looking at their life. We've heard that phrase, having your life flash before your eyes, and it always seems to have kind of a negative connotation, but people can actually, you know, within moments or minutes or however long it may be in these grand psychedelic or near-death experiences, they can reconceptualize their whole story and come out with just a new lease on life, realizing like, wow, here I am, I'm alive. What am I going to do with my one wild life, right? Like, what am I going to do in this time? And this sense of every moment, every day matters, and also a sense of the eternal, you know, that maybe I have a legacy that goes on because I am a spirit, a spiritual being that's connected with all other beings. And so it's really beautiful how the interconnectedness, the web that we're all in, becomes evident because Western culture, whether through healthcare or any other way, is so hyper individualized. And we all need each other. We do.
Sal, do you have anything on that?
Yeah, I love that the relationship between mind and body. I think that's extremely extremely huge. And in the healthcare world, you know, what we see is a lot of patients that have chronic disease. The way the exhaustion that JPC was talking about, the way that manifests in the healthcare world is just almost like a loss of the will to live. Like patients aren't necessarily suicidal by any means, but they tend to, you know, eat poorly or don't take their medications or stay in toxic relationships. And these things kind of just compound on each other, and it kind of keeps them sick and keeps them in the hospital and keeps them coming back. And so my hope is that, you know, using psychedelics, that we can kind of address what's keeping these people down, what's keeping them with the loss of their, you know, willingness to kind of keep going and stay active and just be happy. And so I think that if we can address that issue, then people will be more willing to eat better or take their medications or you know, exercise more and go, you know, be with their loved ones more. And then those things just compound on each other, and it kind of has an exponential effect where, you know, family members notice that their loved one is more happy and trying to heal, and that empowers them to want to be, you know, more happy and want to be there for them. And so, yeah, I'm just hopeful that this movement that we have going on can have, you know, an effect in that way too.
So we're getting into territory here. A lot of the reason that people decide that they are going to give this a shot is because of various traumas that they have experienced in their lives. And sometimes these things are complex traumas that have gone over, that have happened for a very long period of time. And there's also been a lot of study that is ongoing with people who have acute, like combat trauma, the things that they dream about and so forth. And I just think about, what if this had been around at the time when my grandfather came home from Iwo Jima? Maybe he wouldn't wake up screaming every single night for the next 15 years. So can we talk about the experience of trauma-informed care as it relates to how you perform what you do and what you see people kind of transcend their trauma, how they do it, and what's happening with that?
Yeah, so traumatic events are things that interrupt or disrupt our ability to cope, whether it's a one-time thing or it's a chronic thing extending over a period of time, potentially years or even decades. And so a conception that I like of trauma is that there is the event that induces the trauma. The trauma is the thing that happens within us when our defenses, our abilities to cope are overwhelmed. And this is a universal phenomenon, whether it's combat-related trauma, as you were mentioning, which was kind of the first conception of post-traumatic stress disorder, PTSD, was combat-related, shell shock, and since then we have broadened, and I think still in the DSM, we haven't broadened enough what PTSD is. We use CPTSD, which is complex post-traumatic stress disorder. We use that now more and more in popular jargon, this idea of chronic PTSD symptoms, that come from not only a single event, but from something maybe like a parent who's really dysfunctional and abusive, so it's not that it's a one-time thing, it's that there's a daily lack of safety over a period of years. And that's something that the DSM hasn't embraced so far. They have, acute versus chronic PTSD. So they're kind of a little bit nudging in that direction. But this idea of complex PTSD that interrupts our ability to relate to ourselves and to others, to form healthy bonds and relationships in the world, is still something that, while we use it, amongst us healthcare professionals, it's still under-recognized in the official, the Bible of diagnoses and mental health. And so really, trauma is a universal phenomenon. Everybody has it in different ways. And the question is, do we have the resources to move through that pain at some point? Sometimes, the amount of pain that is in an event or is in a period of time is so overwhelming that we may not be able to process it all at once, particularly without using tools like psychedelics. Psychedelics can allow people to sometimes, for example, go back into a traumatic memory and maybe they have a different outcome, or maybe it's like it's in a book or a movie and they can move through it and they can realize, oh yeah, that wasn't my fault. And they can heal it in that way. Or they can just realize, if it's a period of years, like I don't necessarily have to go back into each memory or uncover all of those details, but rather I can realize the patterns, realize the thinking and feeling and behavioral patterns that have arisen because of this trauma. And so, it's actually a really sad fact that even in mental health treatment, a lot of times there's really inadequate trauma history being collected. Again, it's like, okay, let's fill out the PHQ-9. Let's see what your depression score is. If your depression score is high enough, we put you on maybe Lexapro. If it's not too high, let's just monitor. Maybe we give you the pills without therapy. Maybe we give you therapy without the pills, but either way, we're not necessarily often actually asking people, how did you get to this point? It's this idea that it's just neurochemicals not being at the right levels makes it seem like it's a quick, easy fix. If that's the case, then yeah, pills should address it. But if it has to do with systemic racism, for example, or if it has to do with an abusive family, or it has to do with, chronic lack of worthiness for other reasons, then that's going to be something that is going to take a period of time to address. And so what's really one of the really beautiful things about psychedelics is that they really just get right to those depths, and open up the things that we do have, the wisdom that we do have within us, that because of chaos and blockages and craziness in life, we can't access sometimes. The amount of pain can be too overwhelming. And so psychedelics can actually get to traumas very quickly, and help us to heal them. And it's really incredible the degree to which healing is expedited working with them, particularly when you have trauma-informed therapy. And really, trauma-informed therapy, there are several different modalities we use at the retreats: internal family systems, EMDR, which is eye movement desensitization and reprocessing. We use somatic experiencing, which is how trauma is stored in the body and how to release that somatically. Whatever the evidence-based trauma-informed therapy is, some of the common core is, I see you and I believe you. I'm not going to gaslight you and tell you it wasn't as bad as you thought it was. Like, I'm going to validate that. Like, it does sound really hard, and a lot of times so many of these traumas happen to people when they're very young. And so something that can be, we can time travel and like go back as an adult and say, oh, well, it wasn't so bad. But to a child, that can be absolutely earth-shattering. And so really just meeting people where they are, validating them and saying, you're not crazy. Yeah, this is really hard. And I'm going to walk this path with you and not judge you and have true compassion for you, and not tell you, okay, just stuff down those feelings, just buckle up and just be fine, just smile. But actually, like, let's move through this. There's something real here. Let's honor it. And allowing people to safely feel, that pain, to safely cry those tears. People can have so much catharsis working with psychedelics. They can just weep, they can, all of a sudden, they're right in touch with their fears and they're able to move through these. And joy is reached by honoring all of that pain rather than trying to stuff it down with symptom suppression or chasing different ends, but rather getting right to it, saying it's real, saying you can do this, you can handle this, you can look at it, and you can move all the way through to the other side. That's what trauma-informed therapy is, and that's something that was super important to me to center at our retreats.
When you talk about like the PHQ-9 and the DSM-5, like I start to twitch a little bit because it's this medical model that really is working to take all of this and put it into some sort of very understandable linear treatment model that's very, very easy to understand. And the Western medical model does a really good job of, it puts pavement over the problems that are deep down. And so there's a freeway over it. That's what Prozac, it's like a freeway paved over the pain that's underneath, instead of digging into the dirt and finding the artifacts, the old pain that's down in there, pulling them up and building toward actual wholeness and restoration, which, if you're not grabbing those pieces of trauma and actually holding them up and dealing with them, they're just under the pavement and they're still there. You still feel them. And so these experiences, a lot of people fear them. They fear going and accessing that trauma because it's scary. It's trauma. It's something awful that happened. It's humiliating. It's scary. It's been haunting dreams and everything like that. So JPC, as you're with people, do people have difficult experiences, and how do you help soothe them in difficult experiences that they may be having?
Sure. I think that what Amy was saying was just spot on, is the validation. There is a power to allowing someone to sit in silence in a space where they feel safe, where, just as she said, they feel seen and they're able to release these feelings. There's a power in that. I would say many times people go throughout their day feeling like they're not seen or they're not in a space where they can really share their emotions. And when you sit in a space with someone or with a group where you're allowed to just be not judged, your feelings validated, as was said, it's amazing how powerful that moment right there is. So one of the things that I provide or support is being that person who can receive and allow you to express, right? And sit there and provide that comfort to you, which many times is just sitting quietly, paying attention to everything that you're saying or not saying. That right there is probably one of the biggest things that I provide. And when I see people going through extreme feelings, many times that in that moment, that's what they need. Just someone who is right there with them, walking that path, saying, hey, if you need to lean this way, I'm here. If you need to lean that way, I'm here. But the fact is, I'm here with you.
That's so incredibly important, because the fear sometimes in an experience is that you are somehow alone and that nobody really does understand. And just the presence of another person there saying, you're fine, experience, go towards whatever this is, experience it. They talk about, if the dragon is chasing you, turn around, face the dragon, pull it in and look through its eyes. That whole, actually experience it, find out what that dragon is doing there and what it's trying to tell you. It's really brilliant what you do. And Sal, physiologically, acute stress and trauma, when we're talking about holistic things and looking at the kind of the Western medical model that tends to separate these things, the eyes, nose, and throat is down that hallway, and mental health is down that hallway, and x-rays are down this, radiology is down this hallway. These things all come together in the nucleus of us, the mind, body, spirit. When you are seeing people with this stress that they're dealing with, this trauma or complex trauma, acute stress and everything like that, what are the physical symptoms that you see as manifestations of that, and how do you see this treatment help change that sort of thing for people?
Mm-hmm. Yeah, I was kind of alluding to it earlier. A lot of times the somatic complaints that we see are really just manifestations of chronic mental illness. And so a lot of times we'll see, chronic abdominal pain is a really big one, chronic headaches, especially tension type headaches, things like back pain that's unresolved. These things, the trauma just kind of lives in the body, and they seem to get exacerbated with, untreated mental illness, I would say. And going back to also what I was mentioning earlier about chronic disease. So, individuals that are not exercising or eating inappropriate, eating not great or not taking their medications, that is the perfect milieu for, diabetes and high blood pressure, and can cause, longstanding heart problems and kidney problems. Basically, your whole body gets affected by those decisions. And so essentially what I really think is that, if we can somehow address what's driving somebody and what makes them tick, and kind of get them back on track a little bit, they'll be more willing to kind of, start anew and basically nip those chronic diseases from happening in the bud, I would say. And so, yeah.
So I wanted to kind of switch gears here and talk about legality. Now, this is being recorded in February of 2024, at a time when just this week there was a bill that Governor Gavin Newsom has asked for to push forward the future of legalization for psilocybin mushrooms to be used in the therapeutic context, and on the heels of another psychedelic decriminalization bill that was vetoed. So there's a it seems to be a greater understanding, likely in great part from the wonderful book, How to Change Your Mind by Michael Pollan, that is opening a lot of people's eyes to the potential of these different types of medications that can help people. So we're focused on ketamine in this here. So can you talk about the legality of ketamine? Why is it legal? In what context is it legal? How is what you do abiding by not only the law, but medical ethics?
So ketamine is federally legal. It's always been legal, which puts it in a unique status compared to other psychedelics. So it was created in the 1960s. Initially, it was used for anesthesia, for actually battlefield wounds as well in the Vietnam War. It's been used for, as Sal was talking about earlier, for procedures, for surgery, pain relief. And we found this happy side benefit that people would maybe come out of surgery and they weren't depressed anymore. They weren't suicidal anymore. And so we realized, like, okay, let's actually do that part on purpose. Let's not just have that as a happy side benefit. And so ketamine is federally legal, has always been federally legal, knock on wood, will continue to be. It has a different story, from something like MDMA, which is looking to be the next one that will be federally legal. MDMA has extremely promising data on PTSD from phase 3 clinical trials, and it is poised to be given the nod, hopefully, fingers and toes crossed, by the FDA this summer or fall, and then to the DEA, which they're the ones who allow you to actually prescribe it. And it will be, used for PTSD federally. And so how are these legal? So ketamine is legal to be prescribed. It is a controlled substance. It's a Schedule 3 controlled substance. So it requires that someone have a DEA license in order to prescribe it. And as long as it's going that route, then it's appropriate. It's used for depression, anxiety, post-traumatic stress disorder, obsessive compulsive disorder, substance use disorder, chronic pain, and the list is growing. It's being researched for eating disorders, for migraine disorders. And so very promising. And a lot of the uses of ketamine at this point are off-label uses, meaning that the FDA hasn't given them the official stamp of approval that this is an official indication. The only FDA officially approved formulation of ketamine is S-ketamine, Spravato, that I mentioned earlier. That's the nasal spray, and it's one of the forms of the ketamine molecule that is the S enantiomer of it. And so that was patented, given the stamp of approval. Actually, from the literature, it appears that both enantiomers, the S and R enantiomers, are very effective for treating these conditions. And so I actually like working with the racemic mixture. That's both the S and the R, and we use it as intramuscular injections in our retreats. And so that's how, ketamine is legal, is via prescription. People can obtain it other ways, but not recommended because, again, it could be mixed with other things. And so you want to make sure you're getting it safely at safe doses and that you really know what you're getting. And then so that will be also similar with MDMA, that it will be able to be prescribed specifically initially for PTSD, and hopefully that will expand over time as well, because I'm very sure it also helps with the other things that ketamine helps with. And similar also, psilocybin, it's coming down the pipeline. It's in phase 3 clinical trials now as well, extremely promising. Even some of the earlier studies looking at patients with terminal illnesses, right? Dealing with the distress, the depression, the worry of when is this going to get me, right? Like, is today my last day or is tomorrow my last day? This kind of just always waiting for the other shoe to drop. With a single high dose of psilocybin, people were actually able to transcend that and embrace, like, wow, I've got this time, let me enjoy it. A whole other way of being with that terminal illness and actually being able to experience joy again. And so psilocybin is poised to be next federally legal substance within the next couple of years, hopefully, based on where the data are in the research trials. And so we're kind of doing this, one by one. And also there are little pockets of legality popping up here or there, like this city or this state. We just work with what's federally legal because we're trying to stay on the unambiguous side of the law. because we have these licenses, and I'm like, I'm taking this license to the grave. But yeah, you can find, depending on what country you're in, different things are legal. Like through much of Latin America, ayahuasca is legal, for example. So depending on where you go, you can get different legal substances. But here at this point in the United States, the only fully federally legal substance that's psychedelic is ketamine.
So right now, ketamine is federally legal, and it always has been. And there are these other medicines that are very close to becoming legal, at least in small areas, to do. Psilocybin mushrooms, MDMA. As these things become legal and they become something that can be done in a therapeutic setting responsibly with care professionals there and everything like that, is that something that your clinic would expand into doing?
Yeah, we would absolutely love to. Yeah, I have training in MDMA-assisted therapy, as well as just, ketamine-assisted therapy and broad-based psychedelic-assisted therapy in general, and several of our team members do. So we're ready. We're poised to embrace MDMA-assisted therapy as the next possibility. Most likely based on, the protocols that have been in place in the research studies. Probably we won't be able to offer MDMA assisted therapy in a retreat setting right away. It will probably lag a bit behind and initially will require clinic-based settings based on the strict criteria they have for following the protocols they did in the research. But hopefully within the next year or two, we should be able to add that to the retreat setting as well. And then we absolutely welcome psilocybin as the next potential, and any other substances that become legal. And really, if we're going to be working with traditional plant and fungal medicines, like psilocybin, then I definitely would really enjoy to have traditional healers who have worked with those also be incorporated. For example, the Mazatec healers from Mexico who have traditionally worked with psilocybin mushrooms. I would love to have a curandero or a shaman who has worked with them traditionally come and help us facilitate. And then we can have that blending that we're already blending, but it's also that we're prescribing this now. This is, a Western molecule in a sense. But yeah, if we're adding the traditional plant and fungal medicines, I want to honor those lineages as well.
So you just very politely called me out on a word that I used, and it's because I've spent so long in the medical model. The word clinic comes up, and you are not a clinic. You are a retreat. You do this based upon an immersive set of an immersive approach and a way that is very different than going into a medical building with a drop ceiling and UV lighting and industrial furniture and everything like that. So it's kind of just a broad question for anybody to jump in here. What is your work like? What does the person experience in coming to you?
So I do want to start off by saying something. This was really present on my mind today, that I actually, when I went to an ayahuasca retreat several years ago, I realized that this is the specific setting where I want to work, as a retreat setting, because it's not only giving a nod to holistic care, it's embodying and living holistic care. It is fully honoring the mind, body, spirit connection in a way that is more difficult to do in a clinic. It's more difficult because, first of all, people actually have a lot of medical trauma. So going to a doctor's office where they maybe haven't been listened to, or maybe they were overprescribed certain things, or they were just in different ways mistreated or rushed through the door because of the pressures that Sal was alluding to earlier. Those are traumas from the hospital. This is a very unique setting where it's a really fresh start. It feels like a vacation, and it is in a lot of senses a vacation. It's a beautiful setting, beautiful indoors, beautiful outdoors. It's a place to really shift into a different level with your nervous system. And we really embody holistic care because we're weaving in not only ketamine assisted therapy, which has the model of preparation sessions, journeys, and integration sessions, but also the entire retreat is really integration, whether it's in a massage session, whether it's in a yoga class, whether it's in one of JPC's meditations, qigong, sound healing, his storytelling, craft making. It's a nature walk. It's time, just honestly shooting the shit and enjoying each other over dinner. It's all of those things. And it really just acknowledges the fullness of humanity rather than feeling like a number or just being scooted through the door. Okay, your session's done. It's time to leave. No, you're staying here tonight. Go to your room, have a nice rest, get up in the morning. We'll see you over coffee. And so it creates more of a family and a friend kind of a vibe. Even though we maintain those professional boundaries, we're still relating to people in a way that feels more organic and natural. And it allows, I think, people to show up in their most real way. And when we're in that most real mode, we can heal the deepest things in a better way as well. And so I consider it a really deep dive into healing and in a very safe container. I really like working with psychedelics in any container. Like, I love them so much that I want to be able to work with them however. And again, we'll happily do so in a clinic setting when MDMA becomes legal. And this is my favorite. This is just the ability of a group to come together, to form new bonds, to become friends, to relate to one another, to partner with people in their journey. We use a lot of self-disclosure in psychedelic-assisted therapy. So we do share, yes, I've struggled with depression, anxiety, PTSD. I'm human like you. We're not, it's not that we're here telling you what to do. It's that we're honoring your process and we're accompanying you alongside for this whole journey.
Yeah, that really is truly the healing environment, the space that encompasses not only the real compassion, the real, not just simply bedside manner, but actual real investment in the person that's going through something that can be either or both wonderful and very personally challenging. That there is and I'm assuming that you do these in large homes, like a home environment. Is that what it is?
Yeah, they are really large homes. So retreat centers, we find different retreat centers. We're based in Southern California. So we've been in Escondido, we've been in Murrieta, in San Diego. We're always looking for other beautiful locations. We hope to add Joshua Tree and Malibu and Santa Barbara, just always looking for somewhere where people can be immersed in nature as well, so that they can go on a nature walk, or they can simply look out their window and go, wow, there's a hawk, there's a coyote, because we are nature too. That's another important thing to acknowledge. That's another way in which we feel separate, and actually we aren't. We are nature as well.
JPC, this retreat environment that just naturally lends itself to healing. How do you see this environment and this kind of model really benefiting people as they work through whatever it is that they're going through?
Oh, it's a beautiful model because you're putting people in a position that they can really just focus on themselves. You're taking a lot of the decisions that we make on a daily basis that sometimes, and they're small decisions, but we have to make them on a daily basis, and you're taking those away. These things are done for you. You don't have to worry about when you're eating, your schedule's made. So really you get to just exist in this space, forge your own path, and just be. And so the environment that Amy speaks of, the nature, the aesthetics of the place, and the genuine human connection that happens there, I feel that some people don't experience that for years. And then they get into this space and they're able to feel that. And then it gives their belief back that I'm okay. Wherever I'm at, I'm okay. And I'm around these humans that are basically saying, I'm okay. And I think that's that environment in what has been curated by Amy and Sal in these Transcendelic Retreats. Those type of events can last a lifetime. Those type of bonds can last a lifetime. And if that's the only connection that people have for years, trust me, that's something that will will carry them through for a long time to have this memory or this experience of this moment in their time that they can always draw back on. So yeah, I can't speak more enough about what the environment presents for people.
And Sal, the kinds of individuals that you see coming through, and I'm talking about, you've talked a lot about the physical issues that people tend to share that have had trauma and are healing and everything like that. When you were working in the medical system, more like the hospital clinic based model, it sounded like you were watching a lot of people who were healthcare practitioners be wounded and have these kinds of stress related things. In this model that you're doing with the retreats, are you seeing people from a certain kind of profession or a lot of people from similar backgrounds or anything like that that are coming through and going, I really have wanted to try this for a long time, and then really getting something out of it?
Yeah. Fortunately, we've been seeing people from all sorts of walks of life. As young as, I think 19 was probably our youngest, up until I think an 81-year-old, I believe, was our oldest participant that we have. We have men, we have women, we have people from different professions. So we've had healthcare workers such as nurses and therapists. We've had veterans, including combat veterans. We have people from, different socioeconomic statuses. We have people from different sexual orientation, part of the LGBTQ community. And so, yeah, we've seen it all, and we're very blessed. I think there's something at our retreats for everybody. We're trying very carefully to have a very diverse team, and have people there at the retreats that each participant can vibe with and find something with. Kind of reminds me, we had some, kind of a rough middle-aged dude who wasn't really, seeking out the individual therapy, wasn't really speaking up during the group therapy sessions, kind of was keeping to himself. And it wasn't until late one night, I think him and JPC had a shared, they're both from the same hometown, and he finally opened up to JPC. And so he found somebody there that he connected with, and he was able to share a lot of his own traumas and stuff like that. And I thought that was really beautiful because, it always seems like there's something at our retreats for everybody. And it's really, really, really awesome to see that. So
JPC, in all of what we've been talking about, your role is very integral to what is done there. You fill in a lot of the space there. You are there for people. You teach incredible skills. You come in with a strong schooling in spirituality and in a sense of support for people that is just simply so present and so accessible. So, your role, what do you think it is that is the most important thing for people to consider when they're looking at doing a retreat like this, and how you see them being able to grow in this before we kind of say goodbye here?
Yeah, so what I see and what I think the most important thing when people look at a retreat like this is, one, there is that prep. So there's that care before, there's that care during, and then there's the care after. I think that's very important when you look at any retreat, and that this retreat has, is that when you leave the retreat, yes, you have physically left, but we have not left you. You're still connected for as long as you need us to be there, for as long as your journey takes us. And I think that's the most beautiful part about when you're looking at any retreat to go to, is that people are there before, people are there during, and after, people are still there supporting your journey.
JPC, thank you for bringing what you bring here. Thank you for bringing
Thank
what you bring to so many countless people who have benefited from you just simply being with them and helping them through an experience like this. So I just wanted to say thank you to you before we bid farewell to you, and best of luck to you in everything that you're doing.
Thank you. You take care. Wonderful meeting you. You take care.
Absolutely. We're going to stay on with Sal and Amy here, and I wanted to talk specifically about what JPC was just talking about there. The concept of integration. This is what happens afterward. There's a lot of choices that people have for going to a retreat, and there's various different people that use various different substances and various different approaches to doing this work. You have a means by which you help people after the retreat is done. Can you talk about what the aftercare is like?
Absolutely. So we include continued ongoing online integration circles for as long as people want after the retreat. And really, integration is the bringing together of different parts into a whole. That's what the word means. And so in the context of psychedelic assisted therapy, you might have a journey, say, where you meet God, and you might have another journey where you're dancing through a bunch of daisies, and you might have a different journey where you confront your greatest fear. And so bringing all of that together, all of those insights, all of that rich information together, and allowing it to actually develop and unfold in your life in different ways and make these positive changes in order to continue to feel better, in order to continue to ascend in your life. That's what integration is. And so as part of our retreats, we include ongoing integration support after the retreat. So we do our first circle online a week after people leave, and that's just for that cohort. And then after that, we have ongoing mixed cohorts where anybody who's ever gone to a retreat can come. And so we offer that as part of the whole package of the retreat. And we really encourage people to utilize that. And so sometimes people come and sometimes they don't. And we trust people to know when they do need that support. And it's a really great way to not only touch base with us facilitators again, but again, to get that peer support and say, oh, wow, this was something that was hard for me. It's really good. It's resonating to hear, like, I'm not the only one that had this. I'm really glad that we are having similar stories here. What you said resonated with me. We are companions on this journey together, this feeling of not being alone. And so that's something that we do offer.
Thank you. And Sal, it occurs to me as I'm kind of going through this, I know that I have a lot of colleagues, and some of them really feel like I'm going way out on a limb here in my attention to psychedelics in the healing field. Now, of course, I'm going through all of the proper channels to be trained in all of this, and so I know a great deal about this, but I do know many of my colleagues, both, doctors, nurses, and therapists that are going, Jeremy, what are you doing? And others that are quietly going, good for you. This is the future. This is where it's all going. So with you in the medical field and the colleagues that you have, what is the general sense of where this is going and the support or lack of support for it in the medical establishment?
Yeah, it's definitely been something that had given me some pause. I would say, am I, risking my license to kind of becoming more, affiliated with with psychedelics and stuff like that. And, I was also, before I've had my own personal, healing experiences and seeing some of my loved ones have healing experiences with psychedelics too. I was skeptical about their therapeutic potential. But, as time has gone on, and I've especially been worked in these retreats, I can see, profound healing that happens using these medicines. And it makes me realize that who's to say that, that I'm not able to offer these type of, medicines to people. It seems like it's just the establishment or the government or some sort of arbitrary body that's kind of just putting these restrictions on us. But I mean, once I've seen it, firsthand, and it gives me a lot more. It makes me feel more empowered, I would say. I think, yeah, as time has gone on, I'm more than willing to offer them. And I think, among my healthcare colleagues and stuff, it's been a resounding like good for you. It's almost like somebody's getting out in a way. Like you feel so trapped sometimes in the healthcare world, and I think people are really proud to see somebody kind of fight back against the man in a way. So yeah, I think it's great.
I I get a lot of that too, and it really does feel like a huge jailbreak almost. Going from, I'd spent a lot of years in a big hospital, and just, for me, looking objectively after several years of being in it to what care is actually being offered in mental health there, and it feels so dry. It's like a 1957 Oldsmobile factory for mental health. It feels so this many days in the emergency room, and then this many hours in inpatient, and then this many hours in intensive outpatient, and then a follow-up appointment. And it's very formulaic. It's not really getting into the heart and soul of the person that is suffering. And that model, it saves lives, arguably. Of course it does. They keep statistics on that sort of thing. But they save lives, but does it actually heal in the ways that really truly benefit the soul of a person? And I think the jury isn't out on that. It is simply that the medical model it doesn't really have what it takes for much of the suffering that is a part of our life. And so these people are suffering for many reasons that are a part of many different echelons of society. So I wanted to talk about your accessibility, because this is not just simply that as something that is there for people who own Mercedes-Benz. Can you talk about how you do accessibility for people who are in need of this?
Absolutely. So there is such a strong profit motive throughout healthcare. And I think this is such a big part of why it's still considered to be off the beaten path or fringe to work with psychedelics, because psychedelics are actually a path where people can potentially go off of medicines that they were having to take every day before, because they were told there's something broken with your brain, there's something broken with your body. This is the way that you handle it, and you're going to need to do this probably forever. That keeps someone coming back, and that keeps feeding the profit motive, keeping people feeling like they are permanently broken. Whereas with psychedelics, it's this notion of actually you're not broken. There are some things that have happened to you that have been painful. We can transcend those things. And so we we do recognize that the retreat cost can be a lot of money upfront for people. Granted, it should save people a lot of money on visits medically, psychologically over the years, and it's still a lot upfront. And so we do have a sponsorship program. We really take into account a lot of factors when we look at who can be sponsorship recipients. So marginalized identities from the BIPOC community, LGBTQ plus community, people with disabilities, people who have experienced a lot of trauma, people who are struggling to pay for things, so people from different socioeconomic realities. We take all of these into account, and then we have someone who comes for free. So we completely waive their program cost at each of our retreats, as well as we work with people if they say, well, we didn't say have the opportunity for them to get the full sponsorship because we were already able to grant that to someone else, but they're saying I'm struggling to pay. We say, okay, well, how much can you pay? Let's work together to make that happen. We can do a payment plan. What amount would actually work for you? And so because of that, we actually Sal and I don't derive a profit from this work monetarily at this point. We derive an amazing soul and spiritual profit from it. It's for sure the best work I've ever gotten to do, and it's an entire privilege to do. And it is work that takes a lot of money. And so we don't want people to ever feel that financial barriers are a reason why they can't access this. People from all circumstances and all walks of life deeply deserve this healing.
I'd like to thank you for coming on Mindful Mutiny and talking about the deeply impactful work that you have dedicated your lives to. I want to emphasize really strongly here to the people who are listening, this work in the medical field, it has been on the fringes for so long. People have risked so much to be a part of work like this, and the coming renaissance that is happening with psychedelic work and the need that there is going to be out there for truly competent people who are ethical, who understand not only just how to treat, but how to treat the spirit of the person, how to treat the body of the person, how to help people integrate in the most positive way possible. This is absolutely critical, and it takes people who are in the medical field and people who are trained in indigenous practices, people who have a long-standing relationship with these molecules, to come forward, stand together, and join up and say, we are not, as a society, fixing people. We're not going towards healing. And this is an avenue that can truly bring a greater sense of healing to so many people, and it needs to be available for people. And for you to walk out of these health insurance jobs that can be so lucrative and go into something that has such potential here for actual real healing, it is absolutely wonderful. And I just want to thank you from all of the people who have benefited from your dedication to this work, for the way that you have had an amazing effect on people's lives through actually standing with your values and going towards something that is so profoundly healing for people. So thank you for being on Mindful Mutiny.
Thank you so
Thank you so much for having me.
Don't forget to like and subscribe to Mindful Mutiny wherever it is that you are watching or listening to this. In a lifetime, there are more decisions than anybody can count. Living the highest form of yourselves is the most rewarding thing that you can do. Make incredible, positive, risky, and bold decisions to be the highest you, and go be something great.